Dear Dr. Adonogiannakis, dear Dr. Brilakis, thank you very much for the invitation. It's a great honor for me to be present here today. I'm going to talk about physical therapy role to non-arthroplasty patients. And the first fact is that the shoulder is the most mobile joint. Shoulder joints take a lot of wear and tear, and therefore they have the potential to become unstable. Shoulder arthritis is one particular painful condition that affects the shoulder joints. Arthritis does only damage muscles and tendons, but also joints and ligaments. Shoulder arthritis generally causes symptoms such as joint pain and limited range of motion. But there is more than one of the kind of arthritis of the shoulder. The AOS has identified 5 distinct forms of shoulder arthritis, like rheumatoid arthritis, that can cause erosion of shoulder bones and deformity of shoulder joints over time. Osteoarthritis, it's the classic form of arthritis associated with wear and tear, and this can affect the shoulder as well as other joints like knees, hands, and hips. The AOS reports that older people over 50 years of age are more likely to develop osteoarthritis. It is characterized by a combination of joint pain, tenderness, and stiffness. Furthermore, post-traumatic arthritis, it's a form of arthritis called post-traumatic, may be developed when injury occurs. Post-traumatic arthritis of the shoulders can cause fluid to build up in shoulder joint pain and cause swelling. Avascular necrosis is a condition that can result in shoulder
accident. Let's go.
Probably going to take money. By destroying the joint tissues in the shoulder. It's caused when blood cannot reach the humeral bone. AVN is a progressive disease, meaning it worsens every time. It can gradually evolve from an asymptomatic disease to mild pain, and eventually it can cause severe pain. Rotator cuff arthropathy has already been talking. Symptoms. Arthritis can cause flares of inflammation in the joints, leading to pain and stiffness. These symptoms can have a significant impact on how much mobility patients have in the affected joints. As a result, arthritis tends to make it more challenging to exercise. However, keeping the joints active can have a powerful effect on the severity of arthritis symptoms. The types of arthritis that commonly affect the shoulder include rheumatoid arthritis and osteoarthritis. We have to look at the exercises that may reduce the damage that arthritis does to the shoulder joints and help patients manage pain. The outlook for arthritis in the shoulder joint is variable. In the early stages of the condition, symptoms are generally mild and do not have a significant impact on the range of motion. When arthritis is more advanced, patients may experience severe pain and reduced movement in the affected shoulder joints. Regular exercises will keep the shoulder joints active, which can have a noticeable impact on reducing pain and improving the range of motion in this area of the body. Patients should exercise with care to avoid further damaging to the joints or surrounding tissues. What can we do for pain control? The most crucial step is to try to control the pain. This can be done in several ways. First, ice is a friend, right? Ice packs are great for pain and can be used on the shoulder for several times during a day if needed. Some people feel that heat is a better treatment for shoulder arthritis pain. Heat is often good for warming up the joint before stretching, but the patients should use whatever strategy provides the best relief. What else can we do as like physiotherapists? We can do acupuncture, we can use, but the findings are really poor about TENS, checker therapy, diamagnetic pump, ultrasound, manual therapy, Malikan techniques, and of course, and I'm going to talk about exercise and stretching. The most beneficial types of exercise for arthritis include range of motion and flexibility exercises such as stretches, which reduce stiffness. Strengthening exercises that build up muscle mass around the joints, which reduce also the strain on them. Aerobic activities such as walking, swimming, and cycling as this improve heart, lung, and muscle function. The following exercises should stretch and strengthen the muscles around the shoulder joint. And this is the most common exercises that I give to my patients. So I'm going to mention the shoulder elevation stretch. It's an exercise that improves the range of motion in the shoulder joint and stretches the muscles. You can lie on your back, hold a broom handle or walking stick with both hands, keeping them the shoulders width apart. Place the handle or stick gently on the thighs. Slowly raise the pole up past the chest, then over the head so that it is almost touching the floor above the head. Keep the arms as straight as possible throughout. Lower the handle or stick slowly back to the thighs. Perform 3 sets of 10 repetitions once a day, and a gentle stretch should be felt in the shoulders, back, and chest as arms move overhead. The second one is the shoulder outward rotation stretch. This exercise also requires a broom handle or walking stick. It improves the flexibility in the shoulder joints, and there are some steps that need to be followed, like lying on your back, keeping the upper arms by your side, bend your elbows and hold the stick above your chest with the hand shoulder width apart. Slowly move the pole to the left until you feel a stretch in the left shoulder. Return to the starting position. Repeat 3 sets, 10 reps per day. Shoulder blade rotations. This rotation stretches the shoulder to promote increased range of motion. To do this exercise, stand in a neutral position with your hands at your sides. Raise your shoulders towards your ears and hold for 5 seconds. Gently squeeze the shoulder blades together and hold for 5 seconds also. Pull the shoulder blades downward and hold for other 5 seconds. Repeat that 10 times. Pendulum exercises, you all know about pendulum exercises. Door lean, the door lean can help stretch the muscle in the shoulders and improve resistance in the joints. Perform the exercise as follows. Stand facing toward doorway and raise both hands above your head. Place one hand on either side of the door frame. Gently lean forward until you feel uncomfortable tension in your shoulder. Hold this position for 15 to 30 seconds and repeat that 3 times. Door press exercises can help build strength in the shoulder joint. To do these exercises, stand in a doorway and bend one elbow into a right angle with a thumb on that hand, pointing toward the ceiling. Press the back of your wrist into the door frame, hold for 5 seconds, repeat with the palm on your hand, using the other side of the door frame. Do 3 sets of 10 reps on each side. Other tips is strengthening the postural muscles. Strengthening the postural muscles would improve overall posture, allowing the shoulders to move more easily in all directions. These exercises require an exercise band. You can stand straight with your shoulders back, loop the exercise band behind the solid vertical object, and hold one end in either hand. Relax your shoulders and bend your elbows at your sides. Pull your elbows backward while squeezing the shoulder blades together. If the exercises band does not provide any resistance, take a step back or loop the ends of the band around your hands. Hold for 5 seconds, repeat 3 sets of 10 reps once a day. It's very crucial to avoid doing exercises that strain the shoulder muscles or put excessive pressure on them, as this can result in injury. Certain stretches may be painful or uncomfortable for some people and not for others. So it is vital to always listen to your body during your exercise. For some people, shoulder exercises such as push-ups or lifting heavy weights can be too intense for the shoulder blades. So, however, light exercise is necessary to build up the shoulder muscles. Always, we have being physical therapists, we have also think about the load and the joint capacity. We have to evaluate and reevaluate every session and every treatment. If the load is more than capacity, then may increase the pain and discomfort to the patient. If the load is less than the capacity of the shoulder joint, then it makes no difference. But if the load equals the joint capacity, then you just have to continue and you just have to trust the process. Aerobic exercise is also essential for physical health and mental well-being. People with severe symptoms could try gentler alternatives to regular forms of exercises, for example, replacing swimming with water therapy. And this form of exercise offers many of the same benefits as swimming, but places less pressure on the shoulders. Some people with milder symptoms may be able to continue with traditional forms of aerobic exercise. Frequency. The most appropriate type of frequency of exercise will vary from person to person. It depends on the severity of the person's arthritis symptoms and other factors such as the amount of muscle surrounding affected joints. And again, we have to evaluate and then reevaluate. lifestyle modifications. Sometimes treatment is to avoid, within reason, the things that make the shoulder painful. Generally, anything that causes pain should be avoided, especially if the pain interferes with the patient's life. If shoulder pain lasts for several days and wakes them up at night, it may be reasonable to question how important that activity is to them. For example, if there is pain while playing golf, it may be necessary to cut down to once a week instead of playing daily. During that speech, I tried to answer 4 out of 5 questions that every patient has. The first question is, what's wrong with me? The second question that all patients have is, what can you do for me? The third question is, what can I do for myself as a patient? And the fourth exercise is, how much does it take? The fifth is, how much does it cost? But it has nothing to do with that. So thank you very much for your attention.